Hello, my name is Juliana Bonin Ferreira, and I'm a clinical assistant professor in swine health and production at the North Carolina State University, and I will focus on risk factors for PRRS introduction. There are different risk factors that can be associated with PRRS introduction in a herd, and I'll break them down so it makes it easier to understand them. Risk factors at the virus level. So it can be based on the strain type and also on the virus stability in environmental conditions. So when I say strain type, I'm just saying that different genetic variants of the virus can cause different types and severity of the disease. In the case of virus stability in environmental condition, PRRS is quickly inactivated by heat and drying, but it's able to survive in extremely cold temperatures and in moist environments. It's also known to be stable for months or years at temperatures of -70 and -20 degrees Celsius and in moist conditions. And it was also estimated that approximately 8 hours of 50 degrees Celsius are needed in order to inactivate PRRS from manure. Now I can move to the risk factors at the host level. It can be based on age and immune status of the animal. Age, pigs acquire innate resistance to PRRS infection as they age, as indicated by reduced duration of viremia and viral loads in blood in finishing pigs and adults compared to weaned pigs. Late gestation sow, even if they have like a strong innate resistance, is a critical population at risk since the virus has a predilection for the reproductive tract. So that's something that we have to consider when we are talking about age. It's also important to note that pigs that are born seropositive, are born from seropositive dams can remain positive on serologic tests for 3 to 16 weeks of age. But then maternal immunity begin to wane and pigs will be susceptible to infection, and this might contribute to the severity of the disease that we see in the nursery when compared to the mild and even subclinical forms that we see in finishing sites. Immune status of the animal, it's important as well. The appearance of PRRS neutralizing antibodies is low and irregular, but can provide some protection against homologous PRRS strains and even partial protection against heterologous strains that are somewhat genetically similar to the one they have been previously exposed. So that's very important. Animals that have been previously exposed to PRRS through natural exposure or vaccination have shown less severe clinical signs when they encounter a new PRRS. It has also been described that animals vaccinated with a modified live vaccine have reduced shedding in aerosol and oral fluid samples. And also vaccination in sows is associated with a decrease in weak-born pigs and pre-weaning mortality. So that's important, again, like the immune status of the animal play a big role on PRRS introduction into a herd. Now I can move to risk factors at the herd level. It can be associated with herd size, herd flow, biosecurity measures, presence of other diseases. So herd size. Both the numbers of direct and indirect contacts are increased in larger herds. That's something to consider. Also, the number of interactions with the outside world, such as removal of dead stock and introduction of new animals. So that's something to consider as well. So a few studies have shown that infected herds are associated with higher odds of having more animals sick compared to non-infected sites. Other studies have also reported that increased number of sows, nursery and finisher pigs were associated with increased PRRS clinical signs and mortality. Herd flow and biosecurity measures. So I can talk about those two at the same time. So continuous flow, it's a problem. It provides a constant introduction of potentially susceptible animals in the herd. So we have always naive animals coming into the herd, and that in this combined with the persistence of PRRS in long-term carriers animals lead to the maintenance of the virus into this herd, into the population of pigs. All in, all out management practices are protective against clinical signs, and also it's associated with reproductive syndrome, possibly through reduction of transmission rate of PRRS within herds. So all in, all out, it's very important, just because like you move pigs together, so you kind of decrease the odds of having like animals naive being introduced to your herd and then like maintaining the disease on your herd. Other biosecurity measures that has been in place, it's like shower in facility, entry protocols, Danish entry system, use of clean and disinfected gloves, coveralls and boots, and like of course like fomites are very important, so the control of them it's important in order to decrease the disease and prevent and control PRRS in a herd. Dead stock removal, it's also an important thing. So that's something that we always have to think about. The truck that's coming to pick up the dead animals. So make sure that's not coming from herds that are infected and then bringing like the virus into your farm. So it's recommended that rendering trucks should be avoided at all times. And composting and incinerating carcasses on the farms are more appropriate. But like we know that it's not always possible. There are many farms that still have like their rendering area, but also there are some farms that have like composting and incinerator at the farm. So what helps in preventing PRRS. Presence of other diseases, it's also important. It's been stated that PRRS infection might be exacerbated if an animal is infected with another pathogen. So it can be flu, it can be PCV, it can be mycoplasma, but like there are many studies showing that like the presence of other diseases can make PRRS worse on your herd. Now we can move to the risk factors at the regional level. So we are going to talk about overall dynamics of modern swine production, multi-site production, pig density, sharing of transport vehicles between herds, and aerosol transmission. So let's start with the overall dynamics of modern swine production. The production is characterized by a high degree of connection between different sectors of the industry and concentration of swine herds in production systems. So we know that like a lot of farms are pretty close in the region that they are. So sometimes like just a few miles between one farm and other. So, and the vast majority of herds are part of a highly connected system. So that's something that's important because they share feed companies, trucks that handling dead stock and cold pigs, semen companies, guild sources, and others. So the same truck like that goes to one farm goes to another. We know that like some like people try to do that things go in a way that like they go from the least contaminated farm to the most contaminated farm, but like that's something that has to be like very accurate. So in order to minimize the spread of PRRS. Multi-site production. So the production systems, they have routine intense pig movement among herds. So you have to move like your weaned pigs to your nursery and from your nursery to your finisher. And that can facilitate disease spread, but can also introduce pools of susceptible animals like nursery, pigs, gilts, and boars on a weekly or monthly basis. So of course, like if you have like a sow farm and you are bringing new gilts, so you are somehow bringing like susceptible animals into your herd. These multi-site production systems are involved in a chain of infection. That's what we say. Therefore, like PRRS status of a herd will depend on the status of the site it is receiving unstained pigs from and to. So that's what I just said. It's very important, like, to make sure that you are bringing animals from the least contaminated herd to the most contaminated herd. Pig density. So that's something that's very important. So again, we know that some areas like the pig density is very high. We have like lots of pigs in the same area. And it's obvious that pigs are at increased risk of being infected or reinfected with PRRS if they are located in a pig dense area. So we have to consider like that the model of transmission from one farm to other, it's not completely understood, but we know that like trucks can play a role, fomite can play a role, personnel can play a role, feed truck can also be associated. So that's something that we have to consider. Sharing of transport vehicles between herds. So as I briefly mentioned before, trucks are important in connecting herds, and there are many, many studies showing that this mechanical transmission of PRRS happens, especially like in cold weather, and that can happen based on the contamination of the transport vehicle and vehicles carried by footwear, like contamination of the swine facilitated by contaminated footwear and vehicle. Like we can also go back to the survival of the virus and contamination of fomites entering the animal space. So you can see that it goes back like to the virus stability and how well they can survive in the environment. So that's very important as well. PRRS viability outside the host in field conditions can provide accidental contamination of vehicles and PRRS transmissions from herd to herd. And again, especially in cold weather. PRRS infected sites are also associated with higher chance of allowing access to their main entrance by the rendering track. So that's very important to consider as well. So we have to make sure that biosecurity is in place and there is a huge control of people and trucks that enter a particular farm. And about aerosol transmission, that's something that's being studied and continue to be studied to this point. It's very important. Herd-to-herd transmission of PRRS by aerial spread has been explored already, as I mentioned. Findings showed that like PRRS farm can share like the same, it's not the same PRRS virus, but like they are very homologous and they are close by, and that support the possibility of aerial spread of PRRS. Another thing that it's being considered like on aerosol transmission is the type of topography in that area. So that's something that's important as well. So based on that, I finalized like the PRRS risk factors section of this training.